Commissioner Meieran,
Yeah.
we're not gonna, this is just for board comments. It's not for sharing
These are my
things.
board comments.
So we're not doing a display.
Anybody has any questions, I thank you for the opportunity.
Thank you, Mayor.
Thank you.
I have a question.
This is public testimony, so
He
we're,
said unless anyone has any questions, and he's the mayor, so I just thought, but I can ask you separately, Mayor. Thank you for
You
being
know where I live. Thank you. Appreciate you all.
Again, they bring all the same people to the same table. They're all like, hey, I saw you just last year, a couple of years ago. And then nothing happens, and then they just keep doing it. And it's mind-boggling. We need to just do it. No more meetings. I would just say no more meetings.
This is Accent Network, and today we have an interview of Multnomah County Commissioner Sharon Meieran.
Welcome. The first question is, what motivated you to go to politics? So your background is quite different, right? It's quite different things you accomplished, which is amazing, right? And that now politician, commissioner, can you tell us why?
Yeah, it's interesting thinking back on it. I am an ER doctor, so I work in the emergency room, and in the ER we see everyone. I mean, and it's so often people who fall through the cracks in the systems of care that are supposed to support them. They end up in a place of crisis, and then they're in the ER. And that's what you do day after day, and especially people with mental health issues, addiction issues, and it's the most expensive and least effective place to deal with people's really underlying issues. Thought, what can I do to sort of stop the flow, to prevent people from falling into crisis, and to help them, if they do have crisis, have somewhere for them to go. And the county it's the local mental health authority, but it does all of the public health, the human services for people who are vulnerable. It's our safety net. I thought if we could do things better upstream before all of this stuff happens and improve our systems, maybe people wouldn't have as much crisis. So, it did make sense. It took a lot of thinking about, because I never would have thought I would go into politics.
So you would like to fix things upstream, you said.
Yep.
Like, can you give us an example of what it is? What would it be?
So I mean, for example, I think back to a kid that I saw in the ER. I think they were 14 years old and had a mental health issue. Parents couldn't take care of them at home and brought them to the ER. It's like, we can't take care of this kid, and we think he might harm himself. So this kid is in a room in the ER, no windows, no exercise, no treatment, because they couldn't do anything before that. He was there for 3.5 weeks.
In the ER?
In the ER, with all, shift changes of doctors, nurses, everyone. It's barbaric. And I just watched this kid. It's like, we've got to be able to do something differently. And so, because the county oversees the mental health system, I thought maybe we could make our systems better.
Catch him in the school.
Catch him in the schools.
That he doesn't need to go into hospital ER setting.
Exactly. And I thought I would get to the county, it would be, we just have to make some little fixes to the system. But I got there, we don't really have a system of mental health care, is what I found out. Very disturbing. And so my time, I've tried to spend deeply studying what we have, but so that we can fix it. And, making efforts to fill those gaps. Make the connections with schools, make the connections with kids.
So you are working full-time as an ER doctor?
No.
And being politician? Okay, so
No.
how is this division of duties now?
So now I am full-time a commissioner. and I work shifts occasionally in the emergency department. So I've been doing that for 7 years almost, and I still do it. And I also volunteer with Portland Street Medicine, which is an organization that provides care to people living unsheltered outside who are homeless.
What is your assessment, your personal assessment? How many mentally ill people among these homeless people you see through your work? 10%?
Oh, no. Of the people
25%?
living outside. So there's a couple of different, it's hard to say to categorize people who are homeless because everyone has a different reason. But broadly, there are thousands of people, tens of thousands who are on the verge of becoming homeless, right on the edge, or they've lost their housing because of a financial issue. Your income doesn't meet your rent, you can't afford your housing. And one thing will put you over the edge. So majority of people are in that category, and they can cycle through, we can get services to help people in that situation. There are about 5,000 to 8,000 people living outside, unsheltered. That population is different. The vast majority of that population does have serious mental illness, trauma, substance use disorder, so addiction issues, and they're very, very hard to house. And so that's the group we see growing, and they're becoming sicker, and we're not keeping up. So that's the biggest problem I see personally.
Like as a commissioner, can you talk about what it takes, what are the duties, what do you do?
Yes,
Problem solving
because
part.
a lot of people don't even know the county exists, let alone what we do. So the county, like I said, we do mostly social services, so aging services, disability services, serve seniors, so elders, veterans. We also do homeless services, and then we do health. So we are the local mental health authority, so we create a system supposedly there. We do public health. We have a safety net health clinic with these health centers. So we do health, human services for people who don't earn enough income to meet their basic needs. Mm-hmm. And then, so that's what the county does. And then the way the county functions, there's 5 of us at the county. So 4 commissioners, and we have 4 districts. So my district is all of the county west of the Willamette River, and then inner southeast of the county out to 33rd Avenue. And so we have 4 of those districts in a county of about 800,000 plus people. And then we have a chair. The chair oversees sort of all of the county. And at the county, unlike the city, the chair has all the power to actually do stuff. So the chair sets the budget, $3.5 billion budget. The chair hires and fires all the department heads, and so she oversees them directly, so health and human services and all of that. She sets the agenda for board meetings. She's the one who has access to all of the information, all the data, anything that happens. She's a CEO, basically, if you think of it as a corporation. So, except even more power. And then we, as commissioners, we do vote on the budget. We can do things around the edges. We can pursue different programs. And if they align with what the chair wants to do, that's great, and there can be some support. If they differ, it's very hard to actually get anything done at all.
What's the protocol and rules of running the board meetings? Because we paid attention that there was a contention between you and the chair, and she was performing as if like you are going against some kind of like all known rules. Like you were asking questions when you're not supposed to ask questions. you brought materials during the time when it's like the meeting was almost over and somebody had to rush to the airport. And I'm like, this was very kind of like strange and interesting dynamics.
When we have such an opportunity to make a difference with so much money and we're squandering it, I'm going to put out an alternative approach. So I'm just going to use a little easel and put it out. And
Commissioner Meieran,
Yeah.
we're not, we're not gonna, this is just for board comments, it's not for
These
sharing
are my
things.
board comments.
So we're not doing a display, we actually have to, we still have Commissioner
If
Broom
anyone
Edwards.
wants to see it, they can see it, and I'll post it, and it will be right here. It's a display of a system.
Okay.
And I will, wow, in this display that I'm not allowed to show apparently, you invest the resources where they fit in to meet the need. The county's been saying it's implementing Built for Zero.
I apologize, but I am going to have to catch a flight within like 5 minutes.
Okay, so,
And I would like to finish my comments. If you want to vote and then I can finish my comments, that's fine. I know what the vote will be, but I'd like to finish my comments.
So tell us about the rules of how the board meeting runs.
There's no like written rules or protocols. But the chair kind of has the power, and so she can cut stuff off. But again, you know, the 4 commissioners, we're independently elected officials. I mean, I had 200,000 plus people in my district who I represent, which is sort of the point I continue to make is, and we're facing urgent issues where people are sick, dying, harmed, and we should be able to talk about these things. But she has the gavel, you know, so she has the power there, and she gets the say.
What is the story of the poster, please?
Story of the poster. So thank you so much for asking about it. And I think, you know, it's so small and it's so big. The reason that I want to speak at these meetings and might say things that the chair might not agree with is because as an ER doctor, as someone who provides services to homeless people, as someone's been involved in this deeply for years, I see people being harmed and it's not okay. And meanwhile, we just have these meetings and we're hitting our little hammer thing. You know, it's not okay. And we don't have a plan of what to do around homelessness. So we throw out ideas for let's do this shelter separately from like everything else. And for me, we need a plan. We need to understand how things fit together. We need a system. And then we can invest our money where it will be most effective instead of what we do now. And so I had a picture to sort of show this, and the chair did not want me to show a picture. Don't know why, but so this is not the actual picture, but this is a copy of the picture that I just sketched. And the main idea, it's these 4 boxes, and it's that people, if they're truly homeless, living outside on the street, what do they need immediately to make them healthier, safer, save lives while we're trying to get housing for people? Because we do not have enough housing for people by thousands and thousands of units. So what do we need? So we want to get them from the streets to shelter. Some people need some treatment, some transition, so that they can get stable, but ultimately working toward housing. So it's a pretty straightforward concept of, you know, okay, let's go here to here to here. Sometimes we can skip, but generally that's the approach. Now, we need to fill in sort of these systems of what do we have now so we understand what we're dealing with, where do we want to get to, and then we can fill in the gaps. That's what a plan is, you know, in a certain timeline. So right
is
now,
ecosystem?
oh, an ecosystem kind of looks like a potato maybe, I don't know. So the ecosystem is this, when we talk about shelter, what I've watched us do over years is, everyone has to go into this kind of shelter or that kind of shelter. For a long time, it was only the big sort of traditional facilities that were indoors. It had to be this specific thing. A lot of people living in them, going to them, hated them because they're terrible. They're scary, there's crime, there's violence, people get their stuff stolen. They're not good places. And so what about other options? And so, we keep glomming onto, like at the city, they said we need safe rest villages, let's do that option. It's like, okay, great, yes, safe rest villages, sure for some people. But everyone's focus turns there. My point is, we need a whole bunch of shelters. So like safe rest villages might be this dot, and then the indoor shelters this dot, little other villages. There's different types of things we can do. Motels, we need to do the right number of things and invest our money in the smartest way to make this sort of holistic system that meets the needs of the people we're actually serving.
There was a discussion between sobering house, withdrawal house, and some other term.
Yes.
So are they fitting the transition housing, or where do you fit this? Because there was also huge discussion that also showed that the people who are working on the chair do not know what they're working for, because all these terms was just like mumble jumbled.
Exactly.
So where does this sobering program fit? Is it in transition? Is it on the street?
It's more on the street. And so what we see is kind of a revolving door so often. So people, and this is how I know this system so well, because people are on the street. They have serious mental illness or addiction issues. They're psychosis, so they don't know where they are. They're agitated, they're violent, whatever. Or just intoxicated or drunk. People have, if they're disrupting the public, not safe to themselves or others, there's only two options of where they can go. One is jail, they can go to jail, or they can go to a hospital, ER. And either way, so we have this big, it's like a revolving door. So if someone goes to the ER and they're drunk or whatever, I will see them. It's like, okay, you're not drunk anymore, you can leave, but you don't have a place to go, so you just go back to the street. And that just happens. Same thing with jail if they commit a little crime, minor crime even. So what is an alternative place for people to go either when they're intoxicated? And there are different terms. So sobering, people are intoxicated with alcohol or meth or fentanyl. We'll probably get to fentanyl, I imagine. And they're lying in the middle of the street or whatever. That's not where someone should be, and that's not safe, and they might die. So a sobering center is where police or whoever vans can bring people where they will be safe, where they'll be on a low cot, where they can just sleep it off, where they can be okay. And the idea is for public safety to be helped. So they'll leave the next day. They're not going to be treated. They're not going to have housing, but they'll be safe and the community will be safe because they'll be in a different space. And they won't take up an ER where they don't need to be or go to jail. So that's sobering. Detox is the same as withdrawal management. That's when people get substance out of their bodies. So that can take 5 to 7 days, and it's when you just stop using. So it's not like you just kind of sleep it off, but you'll probably use the next day. This is like, I want to get off this stuff, and it's difficult. It can be dangerous medically. It can be very painful. That's a medical model. And so you need monitoring and medical stuff. And then you need to go on to have treatment for longer term. That's when you need sort of this transition place to go to recover. And then hopefully you get through that and you need housing. But right now, we do have some treatment places, detox, but people go to those. They go through this horrible process of getting off of drugs. But huge number, I think it's 1,700 out of 3,000 in the last year that went through one of our detox centers. They ended up back on the streets because there's nowhere for them to go. So everyone says, we need more treatment, we need more treatment. And we do, but if we put in more treatment but we don't have the housing, it's just going to be more people that we're throwing money at treatment that's not going to work because they just go back to the street. And when you're on the street, you can't get away from this stuff. So we need to understand who's going to go where, and we need the whole sequence. So I would have another poster about that recovery sort of, from using substances, where you go this to this to this to this. We don't have any of it effectively. We especially don't have the end of it, which is the housing component.
Outreach, organization.
Yeah.
So what's the meaning of this
Okay,
block?
yeah. So, well, if people are living outside on the street in their tent or not, they have mental health issues. They have they don't have IDs usually. They don't have food. Like, where are they going to eat? They are lacking so many things that they would need either to just have some human dignity to survive, or to move on to be able to get into shelter or even housing. If you don't have an ID, you can't do all of these different things. So the tents can get really dirty, there can be stuff around. So outreach is a number of things. So it can range from just cleaning up around these kinds of places to saying, hey, do you need some water? To, hey, do you need some medical care? To, hey, can I help you get into a shelter, get you an ID, help you with that? So there needs to be these outreach services to help people who are literally living outside in squalor on the street.
How are we with this kind of service?
And we're terrible at, so we have really great people. Sorry, I don't mean to be, I'm not going to, try not to be depressing, a downer. We have amazing people doing this work and some really great organizations. No one has a handle on putting it together and coordinating. So the city has a bunch, the county has a bunch, one department at the county has some stuff, health department has another thing, homeless services. No one's putting it together to understand, are you giving all the services to the same small group of people, or are you reaching everyone who needs it? And how are we putting those pieces together? So there's a lot of gaps.
So where is the biggest gap or two?
Your assessment
Your
by
assessment.
being a commissioner.
For me, the things that would help us just, I talk about triage, prioritizing what will make the biggest difference now so that we can breathe a little bit and focus on the other stuff. It's a sobering center. So that place that's not going to solve all our issues, isn't going to get people treated, but will keep them safe and help law enforcement do the job, help the community stay safe. Sobering center's number one. And then recovery housing. So the people who have done the work that we've invested all of this time and resource into treating and getting off the drugs, and they've done it, have a place to go. So that can open up beds for the people we can flow through our system instead of it being a revolving door. So those are two areas I would focus on.
Because there are sobering facilities, but not in Multnomah County, right?
Yeah.
So
our sobering facility in Portland, Multnomah County, closed about 4 years ago. And it was only 11 beds to begin with. Other places, pretty much most of the counties around us do this better. So Washington County, they have sobering places, but they're going to be building a whole stabilization, a center that people can go, that, public safety and the sheriff and police are collaborating with the mental health and addictions people and the homeless services and treatment to be able to get people everything they need in this sort of one area and then help them on a path to recovery. And we just don't have any of it.
I have a question. Yesterday I opened Google
Yeah.
and I put sobering center near me. And I live next to Lloyd Center.
Okay.
And there are like 30 different things popped up. And what I noticed, there are like 4 on Sandy Street, I think 2 or 3 on Burnside, and they're all in east part of Portland. And I'm like, is Google tricking people out? Is this kind of like some nonprofit, independent, or maybe for-profit facilities for money?
Yeah.
And they're just not affiliated with Multnomah County. Or why Google is signaling them as the sobering places?
I'll have to go do that and do my own Google search because there's not a sobering facility in Multnomah County. There just isn't one. And so, but the thing is, there's so much confusion over the language, as you saw at that meeting, that even the people who are kind of leading the work didn't really make the distinctions. And so that's part of the problem. Everyone's like throwing these terms around, but they actually do have meaning, and it's important we all share the same understanding. It might be there are facility, you know, or organizations that do some aspect of the work or some things they kind of throw sobering in, but I don't know.
Another contention during this meeting that you were the only person who voted against the budget. And the other 4 commissioners, they gave critique,
Yes.
but they voted and approved it.
Yes.
So tell us about this money. Maybe you'll explain where it's located. I know we voted, so it's kind of like where we are spending this $62 million now. And if you suddenly, by magic, become in charge of this budget, how would you spend this $62 million?
I think investing in big things that will have an impact is what we need to be doing right now. If we just have money literally falling into our laps, which is kind of what's happening, we owe it to the people we're serving to do the things that will have an impact on not just individuals, the most in need, but also our community as a whole. And that sobering center would be one.
How
Recovery.
much money on the Sobering Center?
Again, this is why no one is planning how we're budgeting our money. Like, I think about my family budget, right? You know, it's like, okay, I have to have meals for a week. What are we gonna do? When I go to the store, I'm gonna plan it out. I have a certain amount of money. It's not like I just like randomly get just a bundle of money. It's like, oh yay, I'm gonna go to the store and tell my kids, oh, you can go buy whatever you want and just bring it back. And how much money do I have? I don't know. It looks like a lot. This is what we're kind of doing, what I see us doing at the county. And there's not the planning of how much does this cost? Where is the highest need? How do we put the pieces together so they make sense instead of throwing everything here and having it impact the rest of the system? So I don't know, is it, you know, say $10-ish million, say. And for recovery housing, the place I would like us to purchase, you know, I think is around $25 million. Then there's services to run the places. So those would be where I'd start.
We did some homework, right, and like
Okay.
watched some local TV, you know, the discussion
Nice. Okay.
about Measure 110. I think you were part of that discussion. It was actually, I think, very interesting. Yeah.
Yeah.
One of the things which I learned is that things changed, you know, eventually after the measure was voted for and the work began, right? Then the new drug came around, not just in Portland, but everywhere, like in the world. But it changed things a lot. So, and we were wondering, like, what are your idea about Measure 110, potential modification? What do you think needs to happen, given that the situation has changed dramatically, right, with new drug coming in?
The situation changing with some very dangerous drugs that have huge impacts. So fentanyl is one of them, and methamphetamine in a different way has had a huge impact. But the problems with Measure 110 were problems regardless of the new drugs. They're just much, much worse because of the new types of drugs that we're seeing. So even if we didn't have fentanyl and meth, the problem with Measure 110 is that it wasn't thought out. It goes, if you want to summarize what we're talking about, like in 2 words, it's like no plan. There's no plan at the state. There was no preparation. There was no like system built around measure what would happen for people. So it's like, oh, we're going to get people treatment. We don't have treatment. It's going to take a really long time to get treatment. And if they get it, like I said, there's nowhere for them to go. You know, it's kind of not putting the pieces together. Then they put together the group giving out the money and had no one with any experience or expertise in giving out hundreds of millions of dollars and going through grants, helping this group kind of people with experience of drug use, substance use, who's giving out the money. They've never done this before, and that's not their fault. But the state did not give them any help. So you had this group giving out all this money to organizations with no real plan. It was a recipe for disaster, and I think a lot of us, and I supported the measure, and I support the concept of not criminalizing just drug use because it's a medical illness, actually. But we didn't have anything built around it to be able to support people so that it would work effectively. So that's even just without fentanyl and meth. And you throw in fentanyl and meth that are very dangerous drugs having huge impacts, and the whole system has blown up. I mean, it makes it even more difficult. But given now, it's been a couple of years and everything has been changing, and all the bureaucracies and all of the systems and the accounting and the data, all of this has changed now because we've gone down that road. So repealing the thing and just going back to how we were, it's not realistic. It's not an option. I think most people agree with that. The lawmakers, the people who know where the systems are at would say repealing it would be a mistake because it's trying to fix a problem, but it will make it worse. And so the question is, what needs to change to make it better? How do we tweak it? How do we change it? And I think there's a lot we could do there, but I don't know if we'll get there. It needs to be drastically changed, in my view, for sure. And we need consequences for all kinds of things that the law does not have. I mean, so much stuff. But if we just pull it, it will throw our health system, it will throw our criminal justice, it will throw so many systems into just dysfunction.
You want to add the bite to measure
Yes.
110
Yes.
with criminalization, a little bit.
I don't know if criminalization if people are using and they're literally not harming anyone or doing anything, I'm not sure that I care that much that those people have a criminal charge. Mm-hmm. The problem is these drugs and the behaviors make people do things that are criminal and dangerous. And if someone engages in any of that activity, we should be really having real consequences for that. And we should be ensuring that maybe you give them consequences, you have to do treatment, like mandatory treatment could be a thing, or you can choose treatment or jail. It's up to you, but not just like here's a citation and that's literally nothing. So we need something.
So you have a law background, and you studied law, obviously, as well as other things. And you also mentioned that it's also a question about legal system change or modification when you're talking about consequences, right? And can you talk a bit more about what do you mean by consequences and what may, in your opinion, needs to happen to legal systems so that you can treat people?
Yeah.
So how can we get the result, especially like a mental health? Yeah.
So I can tell you what I believe needs to happen. Part of the problem is it would require like the state legislature, the judicial system, the correction, all of these other actors. We need to change in state laws in order to line up and work. But that being said, if I could wave a wand, we need to change we call them the civil commitment statutes, the ability to have people do things they may not want to do. So involuntarily, if they're committing a crime and they're using drugs, say, you have to go to treatment. You know, it's not a choice that you have. If people are sort of out there trespassing, but doing things that are dangerous because of their mental illness, we need to be able to say, no, you can't do that. And we're going to treat you even if you don't want to be treated right now because you don't have the capacity to make decisions. Right now, we don't have that. I mean, we have it very, very, very poor version of it.
I want to use long word, institutionalization.
Institutionalization, yes.
So
Yes.
what is your approach to it?
That's the other thing. We don't have the places for people to go. So right now, and this is getting in the weeds, so I
But this
apologize,
is cool.
but it's so
That's, I think,
important.
what our society needs to
Yes.
know. That's why we're having this conversation.
That warms my heart. Because a lot of people, you start getting into it, and that's people just kind of turn off, and that's the problem. Is like right now we got like people governed by soundbite is what I say. You can say the thing that's quick and easy, and it'll get in the papers, and then and they'll be like, yeah, that's a thing. But you start talking about the reality of it, and people are like, oh, this is boring, blah, you know, I don't want to listen. But we need to have those conversations so people do understand. So in the old days, institutions for mental disease is what they called them. Many of them were horrible, horrible places. I understand you went and visited the Oregon State Hospital. It has a terrible, tragic history. People were treated against their will, but like beyond. So that led to the feeling of, you know, we need to get rid of these institutions. Let's treat people in our communities, and we'll just give that money to them and treat in community. So close the institutions. I mean, I remember when it happened, a lot of people will tell you, you could see it on the streets. But they didn't give the money to the communities, and the communities didn't build out those systems. So suddenly, that's when we started to have all of what we're seeing outside. And a lot
Are
of
we
people
late with this community building, or do you think we can
get a handle on
get a handle on it?
I have hope. I mean, I don't know what I'd do if I didn't have some hope that we can do stuff to change our systems now. But we need to act. Like, you can't just keep sort of talking about it and having meetings about it. And that's why I get frustrated at our board meetings, because I see some individuals who don't have the background or understanding of these systems, listening to other people who don't have the background or understanding of these systems to make the decisions of how to spend tens, hundreds of millions of dollars on solutions. And anyone who's kind of done the work and knows the systems like that, these aren't solutions. And that's what's frustrating. But I think that the legislature is starting to understand they need to take action at the state level to change some of these laws, because they're not, Oregon has one of the worst in the country. I mean, in terms of not helping people, I would say. Like they say because of thoughts of individual liberty and freedom, it's like you don't want to infringe on anything, including someone who doesn't understand reality, you know, deciding, hey, I want to go be naked, run around in a parking garage in sub-zero weather and die of hypothermia. I don't feel like we should, that's a civil kind, I feel that's immoral. And so I feel we need to just get a handle on this, to do common sense things, make sure the institutions don't mistreat people, but that we can treat people to get them to capacity where they're able to make informed decisions.
Can we adopt laws to protect doctors that they actually can treat patients against their will when they're mentally incapable or in psychosis? Then the doctor can make decision.
The interesting thing is, for every other illness aside from mental illness. As a doctor, I have the ability to make decisions for patients in their best interests when they don't have the capacity to make their own decisions. The only place we can't do that is mental illness. So on the one hand, we're saying mental illness, it's an illness. We have to treat it like an illness because it is. And it's not stigmatized. It's not bad. It's like you have diabetes, you have mental illness. The thing is, if you don't have capacity to make decisions with mental illness, we're not allowed to do anything against your will unless you're in imminent danger to yourself or others. And that's been interpreted as like you have a plan immediately to go harm yourself. If you don't have that, it's like our hands are tied.
What I'm not going to harm myself, but I'm harming somebody on the street. If I have psychosis, I imagine I don't know what, and I'm going to attack random person because I'll see zombie,
Right.
I see alien, or whatever other hallucination I have.
That is usually not sufficient. I mean, unless there's some indication that the person is going out to, has already harmed someone. Our systems it's so broken. Again, it gets to common sense, and I understand people have been harmed by putting them involuntarily in institutions. So we need to address that and make them supportive and safe and do the right things. But do we need them? Absolutely. And part of the problem too, the state hospital used to be if people were civilly committed for whatever reason because of their mental illness, so unable to understand reality and it was harming people, you could put them in an institution and it was a state hospital. We also have laws if you commit a crime because of a mental illness or something, even if it's a minor crime, you're required to be sent for treatment or restoration to competence within 7 days, and that's constitutionally required. So what's happened, the Oregon state hospitals where you have all these people, and because the 7-day crime thing is constitutionally required, those are the people that get into the state hospital. And at this point, they have filled the state hospital. And so the civil commitment patients that have sort of the same mental illness and issues, just went in through a different door, they're in our hospital systems and they're waiting for beds because there's nowhere for them to go. And so because they're on those inpatient floors in hospitals taking up rooms, the people I see in the ER who need an inpatient room, they don't get an inpatient room. It just backs up the entire system. So we need secure residential treatment to make up for the state hospital. And we need we need hundreds of beds there. So it's really complex, but we can get a hold on it. We just need to have leaders who will allow us to do what needs to be done and implement the right things. I was on a webinar today. It's called the Oregon Health Forum. Put on a webinar about what can we do about our street. Everyone sees the problem. And I was on with an expert, the head of behavioral health at Providence, her name's Robin Henderson, amazing, smart person. Nan Waller, who is the judge of the mental health court, brilliant, amazing person who knows the criminal justice system. And then I was on there and a couple of other people. They could do it. Like if we just said, hey, you do it, we'll give you the authority, they could. And what happens is politicians keep cycling through and the next one, it's like, hey, I'm gonna have a committee that's gonna get together to talk about these things. Again, they bring all the same people to the same table. They're all like, hey, I saw you just last year, a couple of years ago. And then nothing happens, and then they just keep doing it. And it's mind-boggling. We need to just do it. No more meetings. I would just say no more meetings.
Assign the person, put the person
Just
in
put
charge.
the person. That was the question they asked today that the facilitator said, do we, and I don't know what the right word would be, because probably not I'm realizing the audience, they call them in the US, we call czars, the people who just, there's one person who's kind of responsible for making sure this thing happens. And they asked of all of us, do you think we need this in Multnomah County? All of us said yes, whether they're coming from the person with lived experience, person on the front line, criminal justice, all of us said absolutely, because if we don't do it, no one will.
So we're moving on closer to the end of the conversation, and another question is about, so we talked about State Hospital,
Yeah.
Ken Kesey's book.
Yep.
Have you actually read the book or watched the movie, perhaps?
Watched the movie a number of times. I actually haven't read. No, I did. I read the book long time ago.
What Ken Kesey did it have any effect on the problems we're having now, or not?
That's an interesting question. I think it did elevate some of the really bad stuff that was happening at these institutions. And so I'm hopeful that it was able to stop bad actions that were torturing and harming people. You look at Nurse Ratched, and you look at some of the stuff that happened, and it's because that really was occurring. So I think very good that was stopped, but very bad that we didn't have the plan or invest in what to do once
What we
change.
learned from the visit to the hospital,
Yeah.
that actually Oregon State Hospital didn't do these bad things as much as the other ones.
Yeah.
And they also implemented some things that were actually good. So they sort of were the first who started follow the JFK model of community, kind of bringing patients together,
Yeah.
having activities with these patients together, and really trying to treat them. So there was art therapy, there was recreational therapy.
Yes.
And there were some things when they said they took 51 patients to Eastern Oregon on the lake. And after this program, the patients, I suspect it was a mild mental illness, not really severe one.
Yeah.
They kind of they got their identities back. And in about 2 months or 3 months, all the people who went to this recreational site were discharged from the hospital that they were capable of living in society, maybe in
Yeah.
some special housing,
Yeah.
but they didn't need the hospital anymore.
Right.
So that's what I was thinking, is there a hope to have this communal treatment and something to do with these people, that they don't need
Yes.
jail, state hospital.
Totally. Yes. And I would read, if you haven't seen it or read it yet, in Willamette Week, Dr. Andy Mendenhall was interviewed. He works at Central City Concern, and he talks about the things that have gone wrong, a lot of those negatives. He and a group of behavioral health people, those experts and who work in the field, they're putting together what would it take for the right level of care for people, that they need from in our schools, in our, wherever it may be, to just sort of the communal living situation, that it's not secure, you're not locked in, but it's a place for you, to the secure. What would it take? It's going to take hundreds of millions of dollars for the state to invest. They're creating a plan, an actual plan that they are hoping the state will invest in.
Not the county.
Not the
So
county.
it has to be at the state level.
Well, we should do it at the county. I mean, the county could be doing it without the complications at the state level, and we just haven't. So,
If we have doctor make presentation in front of the commissioners and the chair before the next budget approval, do you think it could sway the distribution of the budget funds or not? Or we are so ingrained in just every new year is the same as the old one
it
with
is.
additional
There's a
percent?
movie called Groundhog Day. I don't know if you've seen that movie. You wake up and it's it's the same day. It's like, wait, what's happening? I feel like that at the county a lot. That each year it is the same thing. We have, I mean, this Dr. Mendenhall and the others have been talking to the chair and the commissioners, mostly the chair, because that's who writes the budget. And even with that, what her takeaway was what we got in that meeting. It's like, okay, I don't know. Hopefully, if we keep going with the message, but so far it hasn't.
We are Action Network, so we are working with immigrants, right, of all
Yes,
people from all different
yes.
countries, backgrounds, and like age, and all these different experiences. So they come to U.S., right, and so they probably have this image U.S., right, and then they see people, so houseless people on the streets in the city. You cannot go there, or you can, and maybe something happened to you, or maybe not, right, and they don't understand why. So, in your opinion, what should immigrant people do to understand the problem better and to connect? Part of the we're doing this program is as part of that. But what do you think could help the immigrant community?
I think just education is so important in understanding. And frankly, I think just even what I've heard from you and the questions you're asking and the way you're asking is even just shows a lot more understanding to begin with of some of the issues, and that you're open to learning about them. You saw at the board meeting we had, the thing about our local governments is there is an opportunity to advocate. And if people show up and say, here's what I see and we need to do better. If you have an idea, great, but you can show up at our meetings. Anyone can show up and talk about anything they want to for 3 minutes.
Neighborhoods like mine are overrun with illegal camps. We've had people on our property die. I can't even tell you the monstrosities I have seen and that affect me every day.
If personally not necessarily speaks English very well, or
we have we can have interpreters available, and it is one of my favorite quotes is, it's speak your mind even if your voice shakes. Because I'm an introvert, I don't like to be out there. I don't like to talk in public. It's taken a very long time to, be able to even sort of do it. And my voice shakes and I still worry. But I always think that in the back of my head. Your voice matters, and we do have interpretation services available at the county if you need an interpreter. So do not let that stop you.
I live next to Lloyd Center.
Yeah.
What if we turned this Lloyd Center that they're debating on what to do with it into
A whole
huge community village, and because there are so many hospitals around, and it's right in the center of everything. It's right on public line, and we are giving free ticket to the people who are homeless. It's kind of okay, guys. So it's sort of right there. It just happened naturally that it's empty, because I almost cry there every time I go, and it's empty.
Yeah.
And they are saying let's read, and they're doing baseball field. They're doing Keller Auditorium. I'm like, what if we fix our homeless program? Like, location is there.
That's,
It's a crazy
that is,
idea.
no,
but
it's, I
was,
mean,
but I'm
it's not at all, it's not I will tell you right, it's not a crazy idea, and it's a beautiful idea, and, you know, an idea a little bit lower scale, but very close by, there's a hotel, the Crown Plaza Hotel, could fit 241 people. It's built. You don't need to do anything with it. It has commercial, beautiful, big kitchens. You can teach people skills. Anyway, and you can buy it for not that expensive. I mean, 40 million-ish, but I mean, compared to
But
what
it's
we spent,
within your budget.
Like,
It's
totally
your
within our
62
budget.
million.
And we would have and there's other places around there right by the key, like you said, the hospitals, the behavioral health hospital, detox. The people who own any of that land or space are very interested in not having that happen, and are very influential in terms of that. And sort of, yes, and I think the honestly, the politics of the situation just would not let that happen.
Because Laurelhurst, Irvington, the people there, they just go into lobby and say no in our backyard.
I think it's more that, like, if there was a huge center like that, I think it's both. Right now, we are losing business income tax. We are losing people from the reality is we are losing people from the city. And to have an infusion of something that could excite people, I'm not a huge baseball person, but people love baseball. And, you know, I guess having something that is a big idea that will bring money, resources, interest, something to get people excited about, I think a lot of people really need that. And there's a hope that can be an infusion that will just keep people here. And so putting in something that would have people around it does have an impact. You know, we would have to minimize it, but it still would have an impact. I think that people, it's not bad. It's not a bad, mean, like, not in my backyard. It's literally a just craving, but like, what? We are beaten down, we are leaving, what can we do to save our city? And it's not putting a homeless community in the Lloyd Center. Thinking outside the box like that, thinking that we could do something like that, and putting it all out there and not having things be off the table or say, oh, we're only doing it this way or whatever. Understanding the problem. How many people are out there? Who are they? What do they need? What do we need to build? And then identifying what it could be, and then investing in those things and saying, we can consider the public, what would it take? You know what, that one really won't work for these reasons, but not to just say, we're not going to even consider stuff. We need to consider it and make reasoned, informed decisions based on information and data.
I have one more question to you. You might not know.
Okay.
Who built Wapato prison? Was it Multnomah County? What?
So what happened with Wapato? I do know a lot about Wapato.
Tell us.
Long before my time, I had nothing to do with building it. And so at that time, the sheriff, I can't remember his name.
It doesn't matter.
Yeah, but he, it was 20 years ago. That was the time when they're focusing on, crime, and we need more jail space, and we don't have nearly enough jail space for all the people. We're going to build this new jail. We're going to issue a bond to get the money to build the jail, and we're going to, have voters vote on this to build a jail. They didn't plan on the operations for the jail, but they did issue, there was something that voters voted on to fund operations of the jail. So it was put into the voters' hands. The voters voted to build the jail, but they voted down the measure to operate and provide the services for the jail. So the sheriff's office and the county didn't have the money to operate it. And so it sat there. And instead of sort of figuring out what it would take to operate it and do it, right? It was just like, oh, this jail's there. And then it, went out of vogue. Like, oh, we don't want to incarcerate. We want less people in jail. So why would we use this giant jail? Then the jail was sort of sitting there and it cost, obviously a huge amount of money. And then that's when the conversations started about, well, what could it be used for? And that's where and that's the former chair of the county commission, Deborah Kafori, she just had it in her head, no, we are not using the jail for that. Because I thought, why don't we use this facility as that alternative to jail, as a substance use disorder treatment, or the place for people to go that does need to be secure. Why can't we do that? And I was told at the county by all the department people who the chair hires, oh no, we can't, we can't afford that. There's zoning things. There's all these there's so many barriers to doing anything with it. It's impossible. We can't do it. So we need to sell it, and it's not worth very much. So that's that's what all the information that we got at the county was, basically that message. So sold it for a ridiculous amount, it was like more than we were told it was worth, but tiny amount. Bybee Lakes, I love Bybee Lakes. They're doing a fantastic job. I've supported them from the beginning. And now it's suddenly at the county, it's like, in that big picture I was talking about, we need more, because the state hospital doesn't function for civilly committed people. God, wouldn't it be great if we just had a place that was a facility that was secure, that we could put a few hundred people? Oh, if only, but we sold it. Wapato. Did that answer your question?
Yeah, we have so many more questions.
Yeah. Okay. I'm sorry, and I talk a lot, so I apologize. I don't talk in some bites.
It's a great amount of information. That's exactly what we were looking for. And we covered the poster. So mission accomplished for today. And but we do have a lot of more questions. So maybe we can call it a day today. And thank you for tonight and for your willingness to come and spend this time and basically educate people who will watch this. And potentially, if stars align, we would love to have you again.
I would love it. I would love it. It's really great. It's great talking to you. I really appreciate it. And I would love to.
Thank you.
Thank you.